Every human infant born underwater instinctively holds its breath, slows its heart, and redirects blood from its limbs to its brain and heart. This is not learned behavior. It is a reflex, hardwired into the brainstem, present at birth, shared with every diving mammal from seals to dolphins. You still have it, and it activates in 5 seconds with nothing but cold water on your face. You have triggered it before without knowing what it was. The sharp intake of awareness when you splash cold water on your face in the morning, the sudden calm after plunging your face into cold water on a hot day, the sensation that something shifted, heart rate dropping, breathing slowing, a clarity arriving that was not there a moment ago. That was not refreshment. It was the mammalian dive reflex, a 300 million year old survival program firing in your brainstem, triggered by cold water contacting a specific region of your face, producing a coordinated autonomic response that reaches your heart's pacemaker in under 1 second. There is a nerve pathway from the skin of your forehead to the pacemaker of your heart that crosses only 2 synapses, the fastest cranial nerve reflex arc in your body. There is a component of this reflex that causes your spleen to physically contract and release a reserve of red blood cells you did not know you were carrying. And there is a clinical application in which cold water on the face terminates panic attacks through a brainstem override that works when conscious thought cannot. All of it traces to the same reflex. Start with the trigger, because the anatomy of why cold water on your forehead reaches your heart faster than your cortex can process that your face is wet. That anatomy is the key to everything the reflex produces. Trigeminal nerve, cranial nerve. 5 has 3 branches. Ophthalmic branch, V1, innervates the forehead and the area around the eyes. Maxillary branch, V2, innervates the cheeks and upper face. Mandibular branch, V3, innervates the jaw and lower face. The dive reflex is triggered specifically by cold stimulation of V1 and V2, forehead, periorbital area, cheeks. Cold water on the jaw alone does nothing. Cold water on the chin produces no cardiac response. Cold water on the forehead triggers everything. Afferent signal from cold stimulated trigeminal branches travels to the trigeminal nucleus in the brainstem, which has direct synaptic connections to the nucleus ambiguous, the brainstem nucleus controlling vagal output to the heart. 2 synapses. Skin to brainstem to heart. Trigeminal vagal pathway is one of the most direct reflex arcs in the human nervous system, and its speed is the reason the reflex works as an intervention when slower pathways cannot. Think about what that speed means. The signal from cold water on your forehead reaches your heart's pacemaker and begins slowing it before your cortex has finished processing that your face is wet. You cannot outthink this reflex. You cannot override it with anxiety, with rumination, with the racing thoughts that characterize a panic attack. The reflex operates below and before conscious awareness. It does not need your permission. It does not need your calm. It fires because the trigeminal nerve detected cold on the face, and the brainstem responded the way it has responded in every mammal since vertebrates lived in water. Speed has a practical consequence. You will notice if you try it. The moment cold water contacts your forehead, you will feel your heart rate change before you have consciously decided to keep the water there. The decision to hold your face in the water is cortical, a conscious choice that takes time to form and execute. The cardiac slowing is brainstem, a reflex that fires in under 1 second. Your heart will already be responding before your mind has decided whether to continue. The brainstem moves first. The cortex follows. This ordering reflex before thought is what makes the dive reflex useful in situations where thought has failed. Now, what the reflex does to your heart. Because the cardiac response is the most immediately measurable component, and it begins within 5 seconds. Within 5 to 15 seconds of cold water contacting the trigeminal field, heart rate decreases by 10 to 25% in most healthy adults. Reductions of 15 to 40 beats per minute have been measured in subjects who submerged their faces in water at 10 to 15 degrees Celsius. Gooden at the University of Leeds documented this across multiple studies published in Clinical and Experimental Pharmacology and Physiology. Reduction is dose-dependent on temperature. Colder water produces greater bradycardia, with maximum effect between 0 and 10 degrees Celsius. Water at body temperature produces no reflex. The trigeminal cold receptors require a temperature differential to fire. If your resting heart rate is 75 beats per minute, typical for an adult over 65, cold water on your face can reduce it to 60 or below within 15 seconds. You will feel this. The sensation is distinctive. A sudden awareness of the heart beating more slowly, more heavily, more deliberately. The chest feels different. The breathing naturally deepens. The subjective experience is calm arriving, uninvited, calm that you did not produce through thought, through breathing technique, through willpower. The brainstem produced it. The trigeminal vagal arc produced it. Your cortex merely noticed that it had arrived. Bradycardia is mediated by increased vagal tone. Acetylcholine release at the sinoatrial node slows the pacemaker firing rate. This is the vagal mechanism that slow breathing activates, but the dive reflex produces a vagal response of greater magnitude and faster onset than any voluntary breathing technique. Slow breathing produces a vagal shift over minutes through gradual entrainment. Cold water on the face produces it in seconds through a hardwired reflex arc. Both arrive at increased parasympathetic tone. The breathing route is gentle and gradual. The trigeminal route is direct and immediate. If you have been practicing breathing exercises for vagal tone, box breathing, extended exhale techniques, 4-7-8 breathing, you have been using the slow pathway to a destination that cold water reaches in 5 seconds. Neither is better. They are different speeds to one autonomic shift. The breathing exercises train the vagal system over time, building tonic vagal tone that persists between sessions. The dive reflex produces an acute vagal surge that is immediate, powerful, and temporary. The person who does both, chronic vagal training through breathing and acute vagal activation through the dive reflex when needed, is using the full range of tools the autonomic nervous system provides. One note for the person over 65 taking heart rate lowering medication, beta blockers like atenolol or metoprolol, which pharmacologically suppress sinoatrial node firing rate. The dive reflex produces its bradycardia through vagal activation on top of the existing pharmacological suppression. The two effects are additive. A heart already slowed by beta blockade that receives an acute vagal surge can drop below 50 beats per minute, producing dizziness or lightheadedness. The reflex is real. The mechanism is safe in most people. The person on heart rate lowering medication should be aware that the reflex stacks on their existing suppression and should start with brief exposure, 5 to 10 seconds of cold water rather than 30, to gauge the combined effect before extending duration. Well, and the cardiac response is only the first component, because the dive reflex does something to your blood distribution that no other non-pharmacological intervention produces, and it happens simultaneously with the heart rate drop. Second component of the reflex is peripheral vasoconstriction. Sympathetic activation in the blood vessels of your limbs and skin surface that dramatically reduces blood flow to the extremities. This is not the general cold vasoconstriction that occurs when your hands get cold on a winter day. That is a local thermoregulatory response driven by the skin's own temperature sensors. The dive reflex vasoconstriction is central, commanded by the brainstem, affecting all 4 limbs and the entire skin surface simultaneously, pulling blood from the periphery to the thoracic cavity in a coordinated redistribution that begins within seconds of the facial trigger. Your fingers will feel it. Within 30 seconds of cold water on your face, the skin of your hands begins to cool, not because the water touched your hands, but because the blood vessels serving your hands have constricted in response to a signal from your face. The blood that was warming your fingers has been redirected to your core. The hands cool. The chest warms. The redistribution is measurable in skin temperature within a minute of the trigger. What makes this reflex unusual is that it is one of the few physiological states where your sympathetic and parasympathetic nervous systems activate simultaneously. Vasoconstriction is sympathetic. Your body is constricting peripheral vessels to centralize blood volume. Bradycardia is parasympathetic. Your heart is slowing to reduce oxygen consumption. The two branches of the autonomic nervous system, which normally operate in opposition, sympathetic for action, parasympathetic for rest, are both firing at once. The body is not choosing between action and rest. It is performing triage, deciding which organs receive oxygen and which can wait. In trained divers, this redistribution increases central blood volume by approximately 700 milliliters, a significant fraction of total blood volume. In untrained adults, the redistribution is smaller. The magnitude scales with training and the intensity of the trigger. But the direction is identical. Blood moves from periphery to core. Oxygen is concentrated around heart and brain. Your heart and brain receive a larger share of available oxygen without your cardiac output increasing. The body is performing emergency resource management in response to a signal from the skin of your face. You see, the dive reflex is not a calming response. It is a survival response that happens to produce calm as a side effect. Your body is not relaxing. It is redistributing, slowing the heart to reduce oxygen consumption, pulling blood to the core to protect vital organs, suspending metabolic demand in the periphery. The subjective experience is calm because the parasympathetic component, the bradycardia, the vagal surge, dominates your conscious perception. The objective physiology is an emergency program prioritizing the two organs that die first without oxygen, heart, and brain. Everything else waits. Calm you feel is real. The mechanism producing it is not designed for calm. It is designed for survival. The distinction matters because it explains why the dive reflex produces a quality of calm that breathing exercises and meditation do not quite replicate. Breathing techniques produce parasympathetic activation through gradual entrainment. The dive reflex produces it through emergency override. The subjective quality is different, sharper, more sudden, more complete. The person who has experienced both recognizes that the dive reflex calm has a different texture. It arrives uninvited, fully formed, without the gradual build that breathing produces. The brainstem does not ease into the response, it fires it. Purpose becomes clear when you consider the reflex in the species that still use it for survival. Weddell seal reduces its heart rate from 80 to 15 beats per minute during a dive, from normal mammalian rhythm to near suspended animation, allowing submersion for over an hour on a single breath beneath Antarctic ice. The seal's muscles, skin, and digestive system are functionally shut off from oxygenated blood for the duration. Heart and brain receive everything. The program that produces this response in the seal is the program that fires in your brainstem when cold water hits your forehead. Attenuated in magnitude, your heart drops 10 to 25%, not 80%, but identical in architecture. Trigeminal trigger, vagal bradycardia, sympathetic vasoconstriction, central blood shift. Your body runs the SEAL's program at reduced power. The reduction is appropriate. You are not diving beneath Antarctic ice, and a full SEAL magnitude response would be dangerous in a terrestrial mammal. The brainstem scales the output to the context. But the program is complete. Every component the SEAL uses is present in your reflex. The trigeminal trigger fires it. The vasoconstriction centralizes your blood. The bradycardia slows your heart. The splenic contraction releases your oxygen reserve. The architecture is unmodified. The amplitude is adjusted. The program is ancient and running in your brainstem right now. And then, the oxygen reserve. Because your spleen is holding something right now that most people do not know their spleen holds, and the dive reflex releases it. In 2012, Erika Chagaté at Mid-Sweden University published findings that the mammalian dive reflex in humans includes splenic contraction. Your spleen, an organ most people think of only when it is surgically removed, stores approximately 200 to 250 milliliters of concentrated red blood cells, roughly 8% of your total circulating red cell volume, packed and waiting inside a fist-sized organ in your upper left abdomen. During the dive reflex, sympathetic stimulation of the splenic capsule smooth muscle causes contraction. The spleen physically squeezes, expelling its stored red cells into the bloodstream. Chagaté measured hemoglobin and hematocrit increases of 2 to 4% during breath hold. Diving maneuvers that triggered the reflex. Your blood's oxygen carrying capacity increases within seconds, not from breathing more, not from a supplement, not from a transfusion, but from an internal reservoir releasing its contents in response to a brainstem signal triggered by cold water on your face. You have been carrying this reserve your entire life. Every moment of every day, your spleen has been holding approximately 8% of your red blood cell volume in a concentrated reservoir, packed, oxygenated, waiting for a signal that your modern life has almost never provided. The red cells in your splenic reservoir are replaced regularly through normal hematological turnover. They are not stale, not degraded, not a leftover. They are a current, maintained, ready reserve. The trigger that releases them is the dive reflex. The trigger that produces the dive reflex is cold water on the trigeminal field. The system has been waiting for a signal that a seal receives hundreds of times per year, and that you have received if you have ever submerged your face in cold water, perhaps a handful of times in your life. Think about what that means physiologically. Your spleen is holding a reserve of concentrated red blood cells right now, packed, oxygenated, waiting. A 5-second trigger, cold water on the trigeminal field, causes the spleen to contract and release those cells into your circulation. Your blood becomes measurably more capable of carrying oxygen within seconds of the trigger. The reservoir exists. The trigger exists. The system was built for emergencies that terrestrial life rarely produces. Cold water on the face activates it anyway, because the brainstem does not know you are standing at a bathroom sink rather than diving beneath the surface. That splenic response, an organ physically contracting and releasing a hidden reserve of oxygen-carrying cells into the bloodstream in response to cold water on the face, reframes what the dive reflex is. Because it means the reflex is not merely slowing the heart and redistributing blood, it is mobilizing a stored resource. The body has an emergency oxygen tank that most people will never use, never know about, and never activate, because modern life does not provide the trigger. The trigger is cold water on the face. The tank is in the spleen. The system is fully operational. Now, the clinical application. Because psychiatry and emergency medicine have already adopted this reflex as an intervention, and the reason it works in panic is the reason it works in the brainstem. Vagal maneuvers are established treatments for supraventricular tachycardia, rapid heart rhythms originating above the ventricles. The dive reflex produces the strongest vagal response of any non-pharmacological intervention, stronger than carotid sinus massage, stronger than Valsalva maneuver, and available to any person with access to cold water. Psychiatrists and psychologists working with panic disorder, acute anxiety, and PTSD-related hyperarousal have documented that cold water applied to the face during a panic attack can interrupt the sympathetic spiral rapidly. Clinical reports describe resolution within seconds to minutes, though the precise timeline varies with the severity of the episode. Mechanism is direct. The trigeminal vagal reflex overrides the sympathetic activation driving the panic response. The vagal output is involuntary. It does not depend on your ability to regulate your breathing or control your thoughts, which are precisely the capacities that panic compromises. The reflex bypasses the cortex entirely. It works when thinking fails. Dialectical behavior therapy. Marsha Linehan's evidence-based treatment for emotional dysregulation includes the TIPP technique, in which the T stands for temperature, applying cold water to the face to trigger the dive reflex during emotional crisis. The intervention is a standard component of validated clinical practice, not an experimental technique. It is prescribed because the brainstem pathway is reliable. The trigeminal vagal arc fires regardless of the patient's cognitive state, emotional state, or willingness to engage in therapeutic techniques. The reflex requires no cooperation, only cold water and a face. Clinical adoption is significant because it means the reflex has been tested in the population where it matters most. People in acute psychological distress whose cognitive functions are compromised, whose ability to follow instructions is minimal, whose nervous systems are in full sympathetic activation. The dive reflex works in that population. It works because it does not require the cortex. It works because the brainstem pathway fires regardless of what the cortex is doing. The sickest patients, the ones for whom breathing techniques fail, for whom cognitive strategies fail, for whom verbal reassurance fails, are the patients in whom the dive reflex is most reliable. Diagnosis is irrelevant to the reflex. Cold water on the trigeminal field is not. If you have ever experienced acute anxiety, the racing heart, the shallow, rapid breathing, the sense that something is wrong and getting worse, the inability to think clearly enough to calm yourself down, you are experiencing a sympathetic nervous system cascade that your cortex could not override because the cortex was part of the cascade. The prefrontal cortex, the region you use for rational thought, for self-regulation, for telling yourself everything is fine, is flooded with the catecholamines that are driving the panic. Trying to think your way out of a panic attack is using the system that is malfunctioning to repair the malfunction. The tool is broken. The tool cannot fix itself. Reflex bypasses the broken tool. It enters through the trigeminal nerve, reaches the heart through the brainstem, and produces vagal bradycardia that the sympathetic cascade cannot override. Because the reflex operates at a level of the nervous system that the panic response cannot reach. Panic is cortical and subcortical. It involves the amygdala, the hypothalamus, the prefrontal cortex. The dive reflex is brainstem. It involves the trigeminal nucleus and the nucleus ambiguus. The brainstem outranks both. The hierarchy of the nervous system means that a brainstem reflex overrides a cortical-subcortical cascade, the way a circuit breaker overrides the wiring it protects. The reflex does not negotiate with the panic. It interrupts it. Trigger. Cardiac response. Vasoconstriction. Splenic contraction. Clinical override of panic. 5 components of a single brainstem program. One question remains: calibration. And here is what matters about the temperature. Because the reflex is dose-dependent, and the wrong temperature produces no response at all. Water at body temperature, 37 degrees, produces no dive reflex. Trigeminal cold receptors are not activated. Water matches the temperature of the face, and the receptors respond to a temperature differential, not to wetness. Water at room temperature, approximately 21 degrees, produces a weak response. Water at 10 to 15 degrees, cold tap water in most climates, produces a moderate to strong response. Water below 5 degrees, ice water, produces the strongest response, but also risks triggering the cold shock response, gasping, hyperventilation, cortisol spike. Cold shock is sympathetic activation. The opposite of what the dive reflex produces. Too cold, and the two responses compete, the shock potentially overwhelming the calm. Your kitchen or bathroom tap, run cold for 10 seconds, typically delivers water at 10 to 15 degrees Celsius, depending on climate and season. That is the clinical range. Cold enough to trigger a strong trigeminal vagal response, not cold enough to trigger cold shock. The intervention does not require ice. It does not require special equipment. It requires the cold tap and 30 seconds. Duration matters. The reflex initiates within 5 seconds, but reaches full magnitude at approximately 15 to 30 seconds. Beyond 60 seconds, the response plateaus. The autonomic system reaches a new steady state, and additional exposure produces no further effect. 30 seconds is the clinical window, long enough for full reflex deployment, short enough to avoid cold shock in water at the correct temperature. And breath holding amplifies the reflex in a way that reveals how the brainstem integrates multiple signals into a single survival response. Dive reflex is amplified by concurrent breath holding, specifically by holding the breath at functional residual capacity, which is the lung volume at the end of a normal exhale rather than at full inspiration. Apnoea alone produces a mild dive reflex. The brainstem registers the absence of respiratory rhythm and initiates a partial diving response. Cold water alone produces a moderate one. Together, the response is supra-additive, greater than the sum of each stimulus independently. Brainstem integrates the two signals, facial cold and apnoea, and interprets their co-occurrence as submersion. Cold on the face plus no breathing equals underwater. The interpretation triggers the full diving response at maximum magnitude. Bradycardia, vasoconstriction, blood shift, splenic contraction, Your brainstem does not know you are standing at a sink holding your breath voluntarily. It reads the sensory inputs, matches them to the pattern it has been programmed to recognize since vertebrates lived in water, and fires the program. Supradative response means the combination is not just stronger than either stimulus alone, it is qualitatively different. Cold water on the face produces a moderate vagal response. Breath holding produces a mild one. Both together produce a response that exceeds the mathematical sum of the two, because the brainstem interprets the combination as a different situation entirely. Two partial signals become one complete signal. The brainstem reads submersion and deploys the full program. Your body at a bathroom sink, facing cold water, breath held at the end of a normal exhale, is running the complete mammalian diving response. The full program, at full power, scaled for a terrestrial mammal, but architecturally identical to what the Weddell seal runs beneath the ice. Now, the evolutionary depth of the reflex. Because 300 million years is not a metaphor. It is the actual age of the program running in your brainstem, and the phylogenetic evidence is specific. Dive reflex is present in every mammalian species tested, from marine mammals who use it daily to desert rodents who will never encounter a body of water in their lives. The trigeminal vagal bradycardia component has been documented across vertebrate classes, in birds, in reptiles, in amphibians. Whether the full program, vasoconstriction, splenic contraction, blood shift, operates with identical architecture in non-mammalian vertebrates is less precisely established. The phylogenetic depth of the core cardiac component is not in dispute. Implication is that the trigeminal vagal reflex was present in the common ancestor of all terrestrial vertebrates, an aquatic ancestor that lived approximately 300 million years ago before the first vertebrates walked on land. Every terrestrial vertebrate carries the dive reflex because every terrestrial vertebrate descended from an aquatic ancestor that needed it. The reflex was not added to the mammalian brainstem, it was inherited, carried out of the ocean and preserved unmodified in its basic architecture through 300 million years of evolution on land. The program was never deleted because deletion of brainstem survival programs is not how evolution works. Unused programs are not removed. They are deprioritized, maintained in the hardware, fully functional, waiting for a trigger that the environment may or may not provide. The reflex persists in desert rodents that will never see water. It persists in mountain goats, in bats, in primates that spend their entire lives in tree canopies. It persists in you. Your environment almost never provides the trigger. Modern life does not involve facial submersion in cold water. Showers hit the back of the head and body, not the trigeminal field. Washing the face uses warm water. Swimming pools are heated. The reflex that your aquatic ancestors used constantly, every dive for food, every river crossing, every submersion in cold water, has been dormant in your brainstem for your entire life. Not degraded. Dormant. Brainstem reflexes do not degrade from disuse the way motor skills do. They are hardwired, not learned, and hardwired circuits persist indefinitely without maintenance. The dive reflex in your brainstem today is functionally identical to the dive reflex in your brainstem at birth, which was functionally identical to the dive reflex in the brainstem of the aquatic vertebrate that first carried it out of the ocean. The program has been waiting. Cold water on the trigeminal field is the activation signal it has been waiting for. That phylogenetic depth, a program older than every terrestrial vertebrate, older than mammals, older than dinosaurs, preserved intact in the brainstem of a species that has not lived in water for 300 million years, is the fact I cannot get past in the comparative physiology literature, because it means the bathroom sink is not a wellness tool. It is a terminal for a brainstem program that predates the existence of land-dwelling vertebrates and that fires with identical architecture in your nervous system as it does in a seal's. 300 million years ago, the ancestors of every mammal alive today lived in water. When they moved to land, they brought the dive reflex with them, hardwired into the brainstem, inherited by every descended species, unmodified by 300 million years of terrestrial evolution. Seals use it to hunt beneath Antarctic ice. Dolphins use it to cross oceans. You have it because your lineage carried it out of the ocean and never let it go. It is inside you right now, waiting for a trigger that modern life almost never provides. The system does not degrade from disuse. It persists because brainstem programs persist. Cold water, 30 seconds. Forehead, eyes, cheeks. The oldest program in your nervous system fires. Your heart slows. Your blood centralizes. Your spleen contracts. 300 million years of ocean are still in your brainstem. It remembers.